Amlodipine side effects. What you need to know. Hello and welcome. In today's video, we'll talk about amlodipine, a widely used medication for high blood pressure and heart conditions, and most importantly, its side effects. Whether you're already taking amlodipine, considering it, or just want to understand its safety, this guide will help you understand what to expect, how to manage common problems, and when to seek medical help. Make sure to watch till the end, because we'll also cover common side effects you might notice in the first few weeks, rare but serious reactions you should never ignore, and practical tips to reduce discomfort while on this medicine. What is amlodipine? Amlodipine belongs to a group of drugs called calcium channel blockers. It's commonly prescribed for high blood pressure, hypertension, angina, chest pain due to reduced blood flow to the heart, and sometimes for heart failure or other heart conditions. It works by relaxing and widening your blood vessels, so your heart doesn't have to work as hard, and blood pressure lowers gradually. But while it helps millions of people, like any medication, it can cause side effects, some mild, some more concerning. Common side effects. Let's begin with the most common side effects that many people notice, especially in the first few weeks. 1. Swelling of the ankles or feet, edema. This is the most common complaint. It happens because amlodipine relaxes blood vessels, causing fluid to collect in the legs. It's usually not dangerous, but it can be uncomfortable. Elevating your feet, light exercise, and sometimes reducing salt can help. If swelling is severe or sudden, consult your doctor. 2. Headaches. As your blood vessels widen, blood flow changes, which can trigger headaches. Usually mild and temporary, resolving within a week or two. Staying hydrated and taking amlodipine at night can sometimes reduce this effect. Why do headaches happen? Headaches happen when pain-sensitive structures in your head or neck get irritated. This includes blood vessels, muscles, and nerves. Common triggers include stress and tension, lack of sleep, dehydration, poor posture, eye strain from screens, or sometimes medical conditions like sinus infections or high blood pressure. Types of headaches. Let's break down the 5 most common types of headaches. 1. Tension headaches. The most common type. Feels like a tight band around your head or pressure on both sides. Usually caused by stress or muscle tension. 2. Migraines. More intense, often with throbbing pain on one side, nausea, or sensitivity to light. Can last hours or even days. 3. Cluster headaches. Rare but extremely painful, often around one eye, in clusters over weeks. 4. Sinus headaches. Pain in the forehead, cheekbones, and nose, often with congestion. 3. Flushing, warmth or redness in the face/neck. Another result of vessel relaxation. Usually harmless, and often fades with time. 4. Dizziness or lightheadedness. Especially when standing up quickly due to blood pressure dropping. To reduce this, stand up slowly and avoid sudden movements. 5. Palpitations, feeling your heart race or pound. Some people feel their heartbeat more than usual. Usually temporary, but if it's persistent, Talk to your doctor. Rare but serious side effects. Now let's talk about less common but more serious issues. These don't happen to most people, but you should know the warning signs. 1. Severe allergic reactions, anaphylaxis. Signs: swelling of lips, tongue, or throat, severe rash, difficulty breathing. This is extremely rare, but requires immediate medical attention. 2. Very low blood pressure, hypotension. Symptoms: fainting, extreme dizziness, confusion, or inability to stay awake. More likely if you take other blood pressure drugs or have dehydration. 3. Worsening chest pain or heart attack symptoms, in rare cases, especially at the start of treatment. Call emergency services immediately if you experience severe chest pain, shortness of breath, or arm/jaw pain. 4. Severe swelling, edema, in hands, face, or rapid weight gain. Could indicate heart issues or fluid retention that needs attention. 5. Liver problems. Rarely, amlodipine can affect the liver, causing symptoms like yellowing of skin or eyes, jaundice, dark urine, or persistent nausea. Who is most at risk? Some people are more likely to experience side effects, such as older adults, especially swelling and dizziness, people taking multiple heart medications, those with heart failure or liver disease, and anyone taking amlodipine at higher doses, 10 mg versus 5 mg. Your doctor usually starts you on a low dose and adjusts based on how your body responds. Tips to manage side effects. Here's how you can minimize side effects. Take the medication at the same time daily. Some prefer night to avoid daytime dizziness. Stay hydrated, especially in hot weather. If swelling occurs, elevate your feet and avoid sitting too long. Limit alcohol, as it can worsen dizziness. Report any severe or persistent symptoms to your doctor. Sometimes, switching to another calcium channel blocker or lowering the dose can help. Frequently asked questions and myths. Let's go over some common questions and myths people have about amlodipine and its side effects. 1. Does amlodipine cause weight gain? Not directly. The weight gain most people notice is actually fluid buildup in the legs, edema, not fat. If your weight increases by several pounds in a short time, especially with swelling, contact your doctor. It's not true fat gain, but it can feel uncomfortable. 2. Will amlodipine make me tired forever? Most people feel tired only in the first 1 to 2 weeks, while their body adjusts to lower blood pressure. If tiredness continues after a month, your doctor may lower the dose or change your medication. 3. Can amlodipine damage my heart or kidneys? Actually, the opposite. It protects the heart and kidneys by lowering blood pressure. However, if it lowers your pressure too much, you might feel dizzy or weak. Rarely, it can worsen heart symptoms at the very start of therapy, so doctors monitor you. 4. Is swelling permanent? Usually no. Swelling is a dose-related effect, often more at 10 mg than at 5 mg. If bothersome, your doctor might lower your dose, combine it with another medicine, like an AC inhibitor, to reduce swelling, or switch to a different drug. 5. Can I drink alcohol while taking amlodipine? Small amounts are usually safe, but alcohol can increase dizziness and make blood pressure drop more, so moderation is important. 6. Should I stop amlodipine if I get side effects? Never stop suddenly without talking to your doctor. Stopping suddenly can make your blood pressure spike, increasing the risk of stroke or heart attack. Instead, report your side effects. Most can be managed or your dose can be adjusted. By understanding these common concerns, you can feel more confident and safe while taking amlodipine. How to know if a side effect is normal or dangerous. When you start amlodipine, it's normal to feel some changes in your body. But how do you know which symptoms are harmless and which need urgent attention? Normal and temporary side effects: mild swelling in ankles, headaches for the first few days, light dizziness, warmth or flushing in the face. These usually improve within 1 to 2 weeks as warning signs that need medical help: severe chest pain or sudden shortness of breath, fainting or extreme dizziness, swelling of face or throat, rapid weight gain with swelling, yellowing of eyes or skin, possible liver problem. If any of these happen, don't wait. Contact your doctor or emergency services. How to take amlodipine safely. To reduce side effects and make the medicine more effective, follow these practical tips. 1. Take it at the same time every day. Morning or evening, but be consistent. Many people prefer nighttime to avoid daytime dizziness. 2. Avoid suddenly stopping. Even if you feel better, never stop without consulting your doctor. Blood pressure can rebound dangerously. 3. Watch your salt and alcohol intake. Too much salt can worsen swelling. Alcohol can drop your pressure too low. 4. Stay active. Light walking or exercise can reduce swelling and improve circulation. 5. Check your blood pressure regularly. Keep a log to share with your doctor. This helps adjust your dose safely. Real-life scenarios and patient stories. Let's quickly go through a few examples of how people experience side effects, so you can relate. Scenario 1. The ankle swelling. Ollie, a 55-year-old man, noticed his shoes feeling tight after 2 weeks on 10 milligrams. His doctor lowered the dose to 5 milligrams and added a water pill. The swelling went away, and his blood pressure stayed controlled. Scenario 2. The headache worry. Sarah, 40, felt daily headaches for the first week. Her doctor advised taking the pill at night and drinking more water. Within 10 days, headaches stopped completely. This shows why you must never ignore severe symptoms. These examples show that most side effects can be managed, but you must stay alert to serious signs. When to see your doctor or switch medicine. Sometimes, amlodipine may not suit you. Here's when you should contact your doctor for a review. Swelling in ankles and feet that doesn't improve even after dose adjustment. Constant dizziness or fainting spells. Liver-related symptoms: yellow eyes/skin, dark urine. Severe fatigue affecting daily life. Any allergic reaction. In such cases, your doctor may lower your dose, combine it with another blood pressure medicine, or switch you to another type of drug, like an AC inhibitor, ARB, or another calcium channel blocker. Final wrap-up. Amlodipine is safe and effective for millions worldwide, but like every medicine, it comes with side effects. Most are mild and temporary, and can be managed easily. But you should always know the warning signs, monitor your symptoms, stay in touch with your doctor. Taking your medicine correctly can protect your heart, kidneys, and life in the long run. Against your artery
Even a
walls.
30-minute walk can
When
lower
this
blood
pressure stays too high for too
reduce
long,
caffeine
it
and sugary
damages your
drinks.
heart,
As they